Hey everybody, it's Sergeant Beast Larson. I'm just getting on here, waiting for my special guest, Dr. Chip Larson, and here he's coming right now. Let me hit the add button. Hello, welcome.
Hello, can you hear me?
I can.
Okay,
There we go. Now you're moving.
good.
Greetings, everybody. As we like to call it, the Beast and the Professor. This is a podcast about PTSD awareness. Will stray a little bit beyond PTSD to some other mental health things that kind of tie in with it. Um, Obviously, depression and et cetera is going to come. So I'm Sergeant Beast Larson, retired. Just call me Steve. And this is my brother, Dr. Chip Larson, PhD professor, 30 years plus with expertise in the list is about this long. So I'm just going to say stress physiology to start with. How's that sound?
That sounds good. That's what I would say.
I know because that's what you sent me about 3 months ago.
Yeah.
But tonight, as you see from the thumbnail, kind of topic finding your pathway to PTSD. And we've been talking, and with my last 2 weeks, doctor visits going through, and I sent you that message today. They told me on the phone yesterday, UC Hospital, University of Cincinnati Hospital, said that they don't, after my failed, they sent me to the mood disorder clinic 2 weeks ago, and then they said, "Oh, you're in the wrong place. We don't specialize in PTSD and traumatic brain injury kinds of stuff." And then I hinted and I said, "Well, where do the Bengals go? Because I'm close to Cincinnati, Ohio." We don't know. They have their own private people. And I said, "Well, they got to be connected to a hospital somewhere. They should be on a list somewhere, under psychiatry with a little asterisk, and a little footnote that says, special doctor to Bengals, don't call," something like that. And I said, that's a place to start, is where they go. But this neurologist is very close to he did his residency, but he's close to my doctor at Mayfield Brain and Spine, who did this, did a fusion, put a plate and some screws, and things are going well. Got a little scar. You can barely see even if I have a light under my neck. So I had that done August 20th, and then September 17th had the two more fingers done, which I get stitches out on Monday. I can't wait. Nothing like that weird pulling feeling on your hand and you can't grip and hold stuff. And then I get to start moving my finger a little bit better here. But so I'm told I need to go to pain psychology. And then they say, well, we don't have anybody that can help you. And then I contact Mayfield and I'm waiting for them to get back. So this is kind of an ongoing issue for me on my path because I should have drew a little stick figure in there on the side, of that thumbnail where the road forks. And that's me sitting on the side with a bottle of water because I don't know which path I'm going to. And they write on, he wrote on my last visit, severe PTSD and concussion syndrome problems. So I know there's a path. I've read a whole lot of things. And then I've talked to Dr. Chip here, and he's told me a lot of things and sent me a lot of things that I've printed. So I know there's a path. Some of it is through medication, through counseling, through therapy, talking about, and I'm just paraphrasing real fast, trying to relive and reset. We watched CSI today. This lady was doing a rebirth of a 14-year-old, and they wrapped him up in a blanket and beat him and suffocated him on accident, pretending like he was in the womb. And well, it's not medically approved, but it works occasionally. And she decided it was a good idea to do this to this boy on her floor, along with the mother. Anyhow, you know how CSI show is. It's about the evidence. But then there's some shock type therapy. There's different things they're using that's VA approved, but it's not. I can't even think what it would be. It's under the American. What do they call that? That has to be approved for doctors to use. I can't think of those initials.
Yeah, I'm not sure.
I don't know if I'm thinking American Medical Association, not the
Mhm.
FDA. It's not Food and Drug Administration, but it's
Yeah.
one of them three letters that has a bunch of suit
Okay.
types that work in
Yeah.
Washington
So
that
yeah, that would be
that
the AMA.
approve.
Yeah, the American Medical Association. Yeah.
Yeah, what would be reasonable standard? Like if you're in a malpractice lawsuit, this is what comes up. And is this the standard? Well, some things aren't the standard. So the VA is doing things. I am a veteran, but I don't have veteran benefits. I've been out since 1990, so I'm not involved with that. And I'm close to some veterans, but they're not telling me very much about their care and treatment of PTSD or what's going on with that. So I'm going to be careful. I don't want to pry and get into the military stuff and put them down. I don't want to be negative. We want to be positive on the show. So I'm just cautious about all these different things. And then, of course, there's like a shock therapy to reset. And we've seen the old movies. I remember us being young and watching a movie, and the mental asylum. Everybody's got the white on. They hold them down to shock them. Let me tell you
Mhm.
something. If you shock me, you know what happens when I get tased? I jump up and hug people and want to squeeze them. Bad things happen when electricity goes through me. I get excited. I don't get reset.
Mhm.
And you're not going to fix anything in my body. All you did is just give me a 20-minute warm up instantly, and I'm ready to fight or move the world. So shock therapy is not a good idea for me. You know, I've been sprayed with chemical agents a whole lot. I like pain. I'm used to pain, so that kind of therapy isn't going to work. But anyhow, kind of just saying I'm not in the path. I'm not going this way. I'm just way back here looking and watching traffic. And the purpose of this tonight, and we're gonna do all this. I'm about to be done talking here at 7 minutes, so we can try and keep this about an hour, for a good drive for people to work to listen to whatever. But kind of some pathways. Where do people go? Admitting it is the first step, and then what would be like I admitted this to my wife 2 years ago, but I didn't really do anything about it except think and talk to her until I started this podcast last December. And then going through this medical stuff and surgeries, that's when the doctors are trying to get me some professional psychological help. But outside of what I've done, where would somebody go? What if your neighbor came to you and said, "Hey, they just moved in," and say, "Hey, Dr. Chip, I just moved in. I see, you're doing this, you teach these things. I have this problem." And it's kind of different for people from war, from non-war. But
Mhm.
people that have been sexually assaulted or that have witnessed or been in, fatal car wrecks have PTSD and trauma from that. And that trauma is equally severe to them as somebody in a war.
Mhm.
What would be the first thing you would tell somebody? Walking up to you and you're mowing grass and they turn the lawnmower off and you turn your lawnmower off and they're like, "Hi, my name's John Doe. I think I need help."
Mhm. That is
It's
a
a
very complicated question, and
it's a loaded
so I'll
question.
give you. A, yeah, you want a 60-second answer?
So
I better set my watch on that one.
yeah.
Um, I think Steve, one of the challenges with that, especially if you didn't know somebody. So I would assume I knew my neighbor a little bit, and as I knew you a lot more than a little bit. But one of the things that makes that a hard question is that there's it's just complex, and I guess I don't want to give an excuse for not having the right answer. But I think the first thing is that you just engage with somebody and you begin to have a conversation and you find out what's going on, and I think from that conversation, then you begin to get some ideas and make some recommendations. I think the challenge is that the the type of the type of treatment that you would need, especially depending, as the situations are more severe, is usually going to require some sort of medical reference, or referral. And that's one of the challenges is, and I think this is what you've experienced when you look at post traumatic stress disorders and syndromes, and you look at the combination of that maybe with, when we're talking about the CTE. And when you look at the overlap of that, and then, well, one of the complications there, as we've talked about, is that CTE can't actually be diagnosed while you're still alive. It's something that can only be diagnosed post mortem. And so, the conversation as we go there, then, well, what you have when you're alive is a traumatic brain injury, and that's what manifests itself, and can result in PTSD being also magnified. So now you've got two things, some individual symptoms and signs for each of those conditions, and then you have areas where they overlap and kind of magnify each other. And so it's humbling for me to say that, like that neurologist, I'm not sure exactly where to send you next. And so if I knew that about you, so I did send you a list. What I
Hmm.
looked for was traumatic brain injury doctors, and so we found some in Cincinnati, and then in the Cincinnati, Northern Kentucky area, because I think that from our conversations, uh, and the things that you've learned and that you've shared, I don't know that the post traumatic stress is what's causing headaches. I don't think that's what necessarily what's causing dizziness. Some of that could be related to the neck, and so you had surgery there, and it might be 3 months or 6 months before we fully know how your body's
Hmm.
responded to that. And we could keep our fingers crossed that that's gonna resolve the issues, and just things are, as your body heals and recovers, you actually get a lot more back to normal. Maybe that was a contributing factor. But with the traumatic brain injury, it gives you something that can be diagnosed, and it can be treated in real time, and it's less mystical than CTE. And so there are some pretty good doctors in the Kansas City, or well, Kansas City area. If you were here, I knew where to send you. I have one guy, and actually one psychiatrist who I'd sent well from my days in the mental health field, who I send all my friends and family to. And the reason that I send everybody to him is because he thinks about things differently. It's not because of his credentials. It's not even because of his expertise. It's because he has a sense of curiosity about things, and he gets to each individual's situation and doesn't categorize everybody in, oh, you're in this category or this category, so here's what we do next. So it's a way that he works with people. Well, if I knew somebody like that in your area, I would send you directly to them.
Well,
Even if
maybe.
they
I wonder.
weren't
Yeah,
the
does he
yeah.
know anybody?
I haven't seen him for about 5 6 years. He moved up to St. Joe, and I think he's probably retired by now. Um,
Okay.
but that is, I know, when I think about referrals for things that are that complicated, sometimes if I knew somebody who could deal with the complexity and would be able to walk right into the middle of it and kind of sort it out. And um, so I think that, for the traumatic brain injury, um, I think that's just in the next direction. And that's one of the challenges that even physicians in the area, even experts in their area, they're not quite sure where to go next. And everybody knows what their part of it is, but when you start to have those overlapping parts, it's what one idea is as good or as bad as the next. And
Yeah.
unfortunately, that's the part that you're having to just kind of work your way through. um
Yeah. He's the neurologist we talked about. I tried Atavert before, which is for um, dizziness, to try and calm down some dizzy and stuff. Didn't work. I've
mhm,
had the hearing tests. I wore a hearing aid, a tinnitus hearing aid, but I haven't worn it in the last 2 years because my head hurts so bad I can't stand it in my ears, and I can't wear my glasses.
mhm,
But I was
yeah,
missing a little bit of high pitched sound, and that's, in the Air Force. I was running a lot of aircraft, a lot of loud vehicles, a lot
mhm,
of gunshots, and then being in police, a career in law enforcement. A lot of noise and gunshots that way. Helicopters, landing helicopters on the interstate during bad wrecks and or whatever kind of bad scene you need that kind of medical help.
mhm,
So there's a lot of things, a lot of loud noises, and a lot of times, like I said before, figuring out over 50 times that I've been hit, that I've been unconscious briefly enough to see stars or see things crooked.
Mhm.
or here or something weird or not here for a few seconds. So he kind of skipped that. We tried some migraine medicine, and a shot and the other made me really anxiety and panicky. Then he switched it. But I have to wait till next week because I did the shots. Um, I can't think what the other shot is. It worked for Sean, my wife. It's helping her with her migraines. Didn't do anything for me. Made me sick and other side effects. So we stopped that. They gave me a pill that I'll start next week. But they said
Mhm.
because you had a loading dose, wait for a month, and then gave me Nurtec. Well, for her migraines, and she's got complex regional pain syndrome, a nerve disease, and with that, they have what they call cluster migraines. And it's hard to explain, but it's just like these little clusters exploding all throughout their head. So she does the Botox every 91 days. Then she'll do the shot every month. And then she has Nurtec for breakthrough pain.
Mhm.
And this last month has been the best month she's had in 15 years for headaches and migraines. So it's going good for her. For me, I'm not getting what I felt like. And I messaged you a couple of days ago, had a bad
Mhm.
weekend. And this is kind of how I'm feeling. And it's a little bit more than my head. But I feel squeezing pressure in my head all over,
Mhm.
front, back, top, everything. Basically, if I drew a line on my jawbone back to my ear, up my mandibular here, use medical fancy word there, mandibular joint from here up
Mhm.
is crushing. And I tell the doctors, I told them this for 6 months. My head is like crushing, the pressure, and then it's going to explode. And by doing that, I'm really light sensitive, noise sensitive, everything sensitive, very irritable. And I've noticed, it's been a little bit over a month since the neck. This neck fusion, it was outpatient, but they fused two different discs there and put some cadaver stuff in there and screwed it all up. Major, but they're professionals and they do it really quick. So major but simple, if that makes sense. And I was home, I'm turning, I'm going like this. He said, "You'll have little movement. You'll know what not to do because it'll hurt really bad. Just try and take it
Mhm.
easy." So I did. I've been really easy, really gentle with stuff until I fell up the stairs carrying a box of honey buns. Honey buns is important. Sidebar here, sponsored by our father, the pastor, Gerald Larson Sr. He's lived on honey
Yeah.
buns and Mountain Dew, and at 82, he's going like a freight train.
Yeah.
So I think I need to change my diet. I can't do Mountain Dew. I don't like the taste.
Yeah.
But I'm including a few honey buns every week for that's going to be my miracle to get to 100.
Yeah.
So my Sam's box of honey buns, I fell upstairs, jerked my neck and back, and it was not good. It was really bad weekend. That was a few weeks ago. Not only do I feel this crushing into my head, and this is kind of an important part to this and this PTSD, and I close my eyes a lot, but I feel like world closing in on me. I'm not panicky where I'm shaking, my heart's not racing, but I just feel like things are
Mhm.
just getting darker and darker, and I'm like getting wrapped in a cocoon, if that makes sense.
Mhm.
Sean's right there. She's always in the room. We're together, but I just feel like it's us. I feel like one of those movies that's always really dark, those horror movies, and you can barely see, and you just want to cuss at the producer, like, you got to have more light on for us to enjoy your movie, or we're going to flip it in 5 minutes. It just always
Mhm.
seems like everything is so dark and small. I always feel like I'm in a small area, like things are, and I don't remember where I put it. I really noticed in short-term memory kind of things. I saw a basic definition of PTSD, and it talked about anxiety, and I got to see if I can even
Mhm.
remember it. And I googled it. It was on. It was an AI thing, but it talked about irritability. It talked about isolating.
Mhm.
It talked about things in your head. Oh, and it was talking about the fight or flight syndrome and being stuck in the fight syndrome or the flight syndrome. I am
Mhm.
definitely stuck in fight mode because and And the sentence was something about when you lose the sense of fear, and fear is replaced with aggression, something like that. Does that make sense?
Mhm.
And I feel
Yes.
like this, and then thinking about this, I realized I started working at the prison in Georgia in 2015. We moved down there, and prior to that, I'd been a security director for a company in the mall. So I was in a retail mall setting. Things were really quiet, except for the day traveling through Ohio, and I was at a mall where there was an active shooter. But it turned out that this thief tried to run the police officer over, and he jumped on the hood of the car and shot him through the window. But there's shots fired and people running and screaming. I was armed. I take care of my family, and then I went out, got them locked in a place, and I went out to go confront. And it's like just like riots in a prison. I was the first one in the door because the people knew, I could fight. I like to fight. That's where I needed to be. Everybody's behind me. I'm charging in, giving my taser to the other sergeant because you tase somebody, you get tied up with one inmate. I said, I'm not, you shoot two inmates, I'm hitting everybody. And I would go in and I'd start fighting multiple inmates. And I feel like now I'm sitting here and it's been 2 years since I was training to MMA fight, which I told you about, which was funny. At
Mhm.
age 56, I would have been the oldest registered MMA fighter in Kentucky. But since then, I had to stop everything, and then spine surgery started this.
Yeah.
I told you, I'm a warrior without a war. I'm stuck.
Mhm.
So I've lived in that fight mode, I think probably for 20 plus years. And because that's how it is in police. On TV, they always say police first responders, they run towards danger, not away from it. It's because we get there. We get into that one mode, and then there is no flight. You only retreat if you're stepping back to get behind a concrete wall so you don't get shot. You only retreat for your safety briefly. And now I kind of, I'm at home, and life changes with spine and neck fusion, and I don't know where to go. Insert the podcast called Painting for PTSD. I painted my first picture, and this is the second one. I just need to get some sky work done. Got a little Eiffel Tower going here because my middle child daughter loves Paris stuff, so I painted this. It's going to go in her studio because she's licensed to do permanent eyebrows and lips. So it's going to go into her studio when I finish it. She can say, "My dad painted that picture." The other part of my painting I can't show you. I also this summer have become a spray paint artist, and all the garden fixtures, the bears and angels and things that Sean has outside that we've collected over 31 years, I've repainted everything with spray paint. So if you would think I just came back from the flea market if you saw in front of our house, and you'd be like, "Wow, that looks great." Multicolored everything. I got a little bit more to do, but I've just been using painting to create to try and get out of that fight mode. And I told doctor this, and he looks at me and he says, "What was it like to work in a prison?" I said, "Violent and wild." I said, "Hard to explain. I would never recommend medical people work there, though. It's not the place to be." I don't know if you ever did any counseling there, if that was ever a part of your college and therapy building.
No, I had not. I've worked in a state hospital, which was nothing like prison.
Well, in
It
state
has its
hospital,
moments,
yeah,
but
state hospital, and I can tell you the only time work wise, not family wise, but work wise, the only time that I ever got nervous or nervous slash scared was when I went twice. I went with the same officer. We took people down to Kentucky State Mental Hospital in Lexington, and we had to leave guns and knives, weapons locked up. Couldn't take anything. And I went in, and that's the place where the people, the patients there, talking in the air, seeing things, And it was the mental health stuff that I've only read about in a book and seen on TV. I'd never seen it for real. And I really thought, because they all of a sudden started looking at the uniform and we became fascinating to a group. And it was a large enough group that the two of us didn't know if we could fight our way out of it. I've had some fights with people that, that are extreme paranoid schizophrenic, and they feel nothing. They stop at nothing. So I know what kind of fight I was, 2 against 20, 25, that was going to be a problem. So
Yes.
I know. It was
Yes.
different.
Yeah. Yeah, it is a little different. And, it's that's one of those things that, there's a familiarity that comes with it, and I think that that's probably true of any job where you work, whether it's in a prison or a state hospital or anywhere. You become familiar with the environment, you become familiar with the people, and so it gives you a little perspective in the moment. Uh, it's definitely different. Yeah,
Yeah, you got to have a good
it
night's
comes with
sleep.
its challenges. Mhm.
You got to be
Yeah,
sharp. You got to pay attention, and
yeah.
and it builds great observation skills.
Mhm.
Which reminds me, let me get up here onto the bookshelf. I have a partner. We wrote a book. This is probably backwards. Officer Perception: Surviving Danger. This would be a great book for anybody getting into psychology, counseling, and dealing with people, because we talk a lot about. Tim's retired. He was a former Marine and retired from corrections in Illinois. He worked in state prisons, a couple different ones. But when you have a whole career in corrections, you'll spend some time in isolation units, some time over around the death row, when you get to be one of those standout officers like he was. But we talk about perception of things, and it's not what you think. I walk around and I go into grocery and I'm a big fall risk. My head right now, I'm really dizzy. I'm really, really off all the time. I walk through the house with my arm on the side, and we were talking about maybe I should get a cane so that I'm not falling up and down. But I'll go to grocery and I'll get in a buggy to go around. So I'm cruising my little electric car and everybody's looking at me like, "Oh, you don't look like you're hurt." I'm like, "Oh, I want to tell them you should put me through a metal detector, or better yet, try and catch me when I fall here in about 3 minutes.
Mhm.
Follow me around the grocery for 15 minutes and you'll see me have an anxiety attack and start sweating because I can't remember more than the 5 things I'm supposed to get that was typed to me in a text message, which was a funny conversation we had last month. But you don't know. You don't know what things are just looking.
Mhm.
I On TV they say, we watched a movie the other night and they said, "Oh, he's a killer. He's a killer." You're not. Um, oh, it was the guy that plays Thor. It's the movie 12 Strong, where they take the
Oh yeah,
horses and they were
yeah.
hunting. In the
Mhm.
very beginning, he's the new captain and he's talking about war. You remember that scene? And
Mhm.
he's like, he addressed the older guy. He said, "No, I'm the captain. I'm in charge." He said, "No, he's got killer eyes." I've interviewed a lot of people, and I've wrote a book about serial killers and why people. It's called Why People Kill. I'm not 100%, but I can look in a lot of people's eyes and tell you who the bad people are and who's the ones that have that. And it's a different look than that military, that 1,000-yard stare. I can tell. I can point that out too. I was in the military in peacetime. I got out just before the war started, and I got out in '90. But I have a different look and a different stare. I have a different look than normal police, than police you would expect to see. That direct eye contact all the time like this. But I tell people I can see your soul through your eyes, and I'll tell them things, and they're like, "How did you know?" It's on your face. The message right there. People have a billboard, they just don't know it. And you've seen this. You know what I'm talking about.
Mhm.
You heard the stories. You can read that. But yeah. I think it's going to be a tough road in figuring out what I'm doing and what I'm not doing. And I go back to see my surgeon October the 14th, And he's also going to talk about my low spine because I probably need another fusion. I fell 5 times in the 2 days before my neck fusion. He was like, "Okay, well, you're going to do the neck, and you're going to go home and sit down so you don't fall. And when you come back, we're going to talk about your low back, and see if I need to put some screws in that too." So that's a possibility coming up. In which case, I wouldn't do it before the end of the year because my deductible's already been met for insurance. That's another word. I was waiting to throw that word in here. Insurance. Insurance dictates a path in people's mental health care, doesn't it?
Hmm.
Major.
Yes. Yes.
It does. It does. We got we got people in family and through marriage that if you're on state assistance, you can only see doctors in your state. You can only get you're on a different list and protocol, um, and there's a different waiting period. I got insurance for being retired. It's great. They pre-approved me 166,000 for my spine surgery. Well, he did that. He fixed what he said, and you know they always clean up bone spurs and decompress nerves is what they say. They make extra money doing that. It's kind of like, oh yeah, I pulled your tooth, but I've lost these two over here while I was at it. They make more money. I got good insurance through the states, so I get treated in a different way. But and trying to talk to them and to in-law, mental health care is almost opposite of what I'm getting, and they're going to tell me. And I'm not having an 18-month waiting period. When the doctor put that order in at UC, I got into psychology in 3 days. They called me the next
Hmm.
day on a Wednesday and said, "Oh yeah, we got an appointment on Friday." It's the wrong office apparently, but we got you in. They still so you don't need anything for depression. No, I'm depressed, but I'm not taking anything for depression because that's not the major point of my problem. This is what I'm
Right.
here for. This is what he said.
Hmm.
It's in my notes. Okay, I see this. I see that. I see what's going on. No. So you're not this, I said, I'm not climbing trees. I'm not seeing things. I'm not paranoid schizophrenic. And my bipolar, maybe I got 3 personalities. I said, I got a different one when I put a uniform on and you don't want to meet it. I said, and put me in a corner in a dark light. That's the third person. You're not qualified to talk to that third person. So I don't know. I don't know. It makes you, you that expression, you want to bang your head on the wall out of frustration.
Hmm.
I banged my head on the wall so much, and that's partly what caused part of my problem. So that's not going to relieve any frustration. That's only going to make
Yeah.
me like, okay, let's go get a protein shake and get down to business.
Hmm.
So and the doctor laughed when I told him. He's, this surgeon. He's a PhD brain guy, specializing in brain, and he says you're injured in the most unique ways, opposite of the people I normally see, which makes
Hmm.
your treatment different because you got here by the way I try and treat people. So I don't know how to treat you this way when you've already done that and got
Hmm.
hurt. I asked him, I said,
Yeah.
maybe I need to go play football and bang my head around. He's like, no, don't do that.
Yeah. Yeah, I would be curious because I think with when you look at the neurologists for the NFL teams, because they all have to have somebody on the sideline now, and that somebody gets dinged or they get up slow or they get a little wobbly and they take them in the tent and they evaluate them. And if they don't pass that immediate test, then they take them back in the locker room. And usually, if they do that, they're not coming back out anytime soon. And it's the concussions. One of the things that's hard about that, and with the traumatic brain injury and the post-traumatic stress, is that it's all neurological and you can't see it. And so the way that we interact with people, and this kind of helps magnify the issues as well. But if you broke your foot and you had a cast on your foot, and we'd see you and we say, hey, well, let me get the door for you, or we wouldn't ask you to run any sprints or anything like that. And if you were moving a little slow, we would understand. And so, in that way, I think, people are probably more compassionate than we give them credit for if they saw your foot in a cast. But because you can't
Yeah.
see what's going on with the brain,
I
people
have to walk
don't,
like this.
they're not understanding. They don't see it. It's because it's like in a third dimension that is beyond their sight. And so it really that adds to some of the social challenges in working with people or dealing with people because they don't see it, and they expect you how you were 10 years ago or 20 years ago, and and so there's no accounting for um, the trauma to your brain. But when you start to get to the chance to look at some imaging and look at it and how brain blood flow is affected from the trauma and that sort of thing, then you get a real picture that says there is a physical and a structural problem, and it is viewable now. We have better technology now than at any point in time in our medical history, but you can see it. It just then what do you do?
Yeah,
Well,
then that's what I'm gonna to really suggest in trying to invite myself to some testing when I go back on the 14th.
mhm,
Um, I forgot I was gonna say one of the things, I talked about painting and the painting for PTSD. And I'm going to put some links on this when this is done. This shirt, the podcast, I got an apparel shop set up by a guy that does a bunch of apparel things. It's online, so people can get shirts, sweatshirts, hoodie, ball caps. Painting for PTSD logo in the teal, the official color of PTSD. I also have the Beast, Sergeant Larson, variety of colors. Will be in a link. Oh, this is what I was going to say. What if I had a shirt that says I have PTSD and brain injury? Then would people open the
mhm,
door? Would they treat me different or would they run? How would the world act if a shirt says, I see a lot because of Facebook and the law enforcement groups that I'm in. I get links to all these stores, and PTSD is because we do the things other people don't. We run towards it. We have no fear. All these little sayings like we've already talked about. But what if I
mhm,
had a shirt that says I have PTSD or I suffer from PTSD? If I
mhm,
use the word suffer, it's not just having it, it's being afflicted by it. Would the world
mhm.
see me different?
I think that they would, and uh, I think that some people would be more understanding. I think some people would be more opportunistic, and try to take advantage of it. And so
Yeah.
maybe then it's good that some things can't be so obviously seen. And I think what you're saying about the t-shirts, and I think this is one of the challenges I think for anybody dealing with any kind of mental health issues is that sometimes, especially as it relates, well, a lot of things, but as it relates to trauma, sometimes the the putting language to it and the talking about it helps to move it from kind of an emotional response that is, kind of overwhelming or beyond our control. And sometimes people can get flooded. And like you're talking about having some anxiety or almost like an anxiety or a panic attack, you get a flooding of the stress response system, and so sometimes talking about it and giving language to it helps to make it something that's tangible, and it makes it less traumatic, it makes it less threatening. And then there's also a point when sometimes the more you keep talking about it, the more it manifests itself. And so um, there's kind of a fine line. So if I were getting a t-shirt, it'd be like that in Forrest Gump. You get a big smiley face T-shirt, and be happy, right? So I don't know where that line is, and I think that that's kind of an individual thing, and uh, in terms of what people respond to and what their approach is. I think and that's part of the complicated part of it. For some people, the way that you describe it is just facing things head on and looking at it that's your approach. That's the way for you to go. Not sure that everybody could do that, and they might not need a smiley face on their shirt and some sunshine in their orange juice or something.
Yeah, yeah. Boy, I'm slacking in my notes here. This actually is, and part of the podcast has been a couple different things, but this is the third time that you've been on as a guest. I started off this with an introduction and what my goal was, and my goal was to get and you're fitting into this very well because it's an educational thing. and knowledge and experience that you're bringing to us from the other side of what I'm going through. But I did an introduction. Episode 2 was my admission and what it took and how I felt to admit it. And it was really, this goes back to the definition of PTSD, an overwhelming sense of emotion. And it wasn't until after retiring from police and going to Sean's uncle's, um, he was in a hospital, and long story, but we were called and we were all there when they unplugged him. We saw him and he passed. And it's like 20 plus years of violence and death and emotion just came to life. And
Mhm.
it was the first time I'd cried probably as an adult. And since then I've had really weird emotional up and down. We talked a couple, on the first
Mhm.
time that you were on, in back in July, that it was, I figured out that it was okay for me to have any kind of emotion at this point in my life, where before it wasn't okay.
Mhm.
And talking to dad a couple weeks ago about something, and I started to tear up, and I said, we're talking about babies, about dead babies, and me driving them in the police car and stuff. What you and I talked about. He said, I never realized the police went through and stuff like that. And I told him yes and explained, and I said, I'm here and it's okay. It's okay. This is me, and it's okay to be me. But it took a lot to admit to this, and to tell people and to talk to some of my friends that I know have problems that don't. The third episode was the signs I missed. And I went right from admission,
Mhm.
what it took for me to admit to having any problem. And I went to the signs I missed. And then I did a project, and then where I didn't, it was a short video, but I really didn't talk about stuff. But I did a project with Sean. We were fixing a Christmas base with a light in there, and had to fix some wires, do my electrical skills. But it was just showing people the purpose of this. I wanted was, hey, I'm at home. I'm not a counselor. I'm retired from this career, and we're just inviting you virtually to our home, because that's what everybody in this world does, and all these reality shows at home. And it'd be great to have a PTSD reality show and follow me around. That would be great, but they don't. So we do this. But we're on a couch just opening up, like, this is a problem. This is okay. And she's my best friend. And I point to her, and she's been with me and helped me. And I talked about finding outlets. I talked about how it's affected your family. I had a special guest, Connor. He was stabbed very bad, survived that. And he left to prison. He got married and has a new baby that's about 3 months old now. I had a guest, Scott. He came back from Iraq. He got heavily into substance abuse. Family got wrecked. He has his kids back again now. But he really, shed the light about how easy it was to get the substance, and how far it took him, and how ugly the world came for him without dying before he stopped. I had another guest that was very similar to that. I worked with both of them in prison. I talked about struggles with pain management, dealing with pain management for various things in life, and that in itself causes problems. It's Sean's been through a medical malpractice and just total arrogance over insurance money, and that started her nerve disease. The lawsuit we went through, the doctors, it was terrible. We explained that. I did an episode called "For Those We've Lost." My best friend Chris, who was going to be my chief deputy if I won the jailer election, he passed this year, February 13th. I got to see him the night before he passed in the hospital. His wife called. I went to see him, and I could see, and I knew, and family had been there, and he wanted to see me. And shortly after I left, he closed his eyes, and he wasn't responsive, and he passed the next day. I did one I talked about believing in the death penalty, kind of to let some people validate that have been victims the punishment in the justice system. I'm for the death penalty, and I just wanted to talk about it too. I talked about, is the PTSD hidden or locked in your closet, and dealing with it? Don't shut that closet door. And that was a great episode. I had 2 wardens from federal prisons message me on LinkedIn after that episode and said, you brought me to tears talking about this, because they both had been in a war in Iraq in the beginning. They're younger than me. I'm 58. You're 35. I was
I
waiting for
got
you to
t-shirts.
smile.
I got t-shirts that are 35.
Yeah, you do. But I talked about that, about not shutting that door, because then that's when you get in trouble. If you leave that door open, there might be a possibility, and men have to keep that open. And that was a great episode. That would be a great episode for students, people, psychology, and anybody that wants to know anything about PTSD and trauma. Watch that episode and see what I talk about and what things that I admit to and problems. I saw something today or yesterday that reminded me of something. And when I was in Turkey, we've been watching a bunch of CSI, and they said Russian roulette. And the first thing I thought about was this young kid when I was over in Turkey in the Air Force. And we were at a little tiny base called Worldwide Remote, where there's hardly anybody. And I was one of the armors, meaning when our shift came on, I would go in early. You had a clipboard. I knew where everybody's posted, like all 4 of us. And it was dictated by the shift supervisor and signed by the captain always. But the weaponry that we would carry and how much ammo. Stateside, even though I was at a base that had nuclear weapons in Texas, we had the M16. And this isn't a secret. I'm allowed to say it. We'd carried M16 was our basic rifle. We had 120 rounds. Overseas, we carried double that. Air Force carried 240 rounds. If you remember the Marine bombing base, I think it was in Beirut. I can't remember, a long time ago. They drove right up, and the Marines didn't have any bullets, and they blew them up. How do you beat a Marine over? And that's a long story, and that changed after that. But we had all these bullets. Well, they were shooting at us over there. So when I was the armor, I would issue extra and write it down on my notes so I knew, and they'd turn it all in. No biggie. We all kind of did that. We just didn't want to be short of run out of bullets. And I remember going in, I was relieving a guy, and he was sitting there, and he had a 38, and he pulled it out. It was empty. And he says, "Oh, I'm just cleaning them." And then I saw him take and put 2 bullets in, spin the chamber, and go like this and pull the trigger right in front of me, just like that. And within about 2 months of him doing that, and he laughed, and now I freaked out because I knew he was doing this for real, and he could have just been dead right in front of me. And within about 2 months, I was underneath that tree stand when that Turkish perimeter security guy fell asleep, and the Turkish sergeant came by, went upstairs, and I'm looking up. He's about 10 feet over me, and he shot him, blood dripping down. I had to move or it would have dripped on me. So I watched one of my guys play Russian roulette for real, and then I see him shoot and kill the guy right over my head. And it's just like popped in my head last night. About an hour later, they have a scene, and there's a man hanging in there. And Sean was talking to me, looking at me, and I saw this at the corner of my eye, and I was like, "Oh shit." And she turned and she's like, "It's only TV," because she noticed my mood, and I changed, my emotional change when I see people hanging. In 2019, I pulled 8 inmates down that were trying to hang in 3 months period of time. My high school best friend, you remember Kevin, me talking about Kevin from band, he hung himself. I was over in Turkey when it happened. 2 years after high school, he hung himself at his mom's house. So seeing somebody on TV hanging kind of bothers me a lot now that it never used to before, because these people, I relate to people that I've seen. I'm holding people and they're cutting rope or lifting. I'm holding people that are trying to hang. And the world out there doesn't go through stuff like this. They'll never see that once. And there's the expression that I see all the time, this phrase, people go through 3 to 5 traumatic incidents in their whole lifetime. Police go through 10 to 20 every shift.
Mhm.
And that has accumulated, and that's so. And I say these numbers, and I planned this, and I did remember to do this. 10 to 20 critical incidents, life-threatening incidents. I've pointed my gun at a lot of people. Um, I've been shot at. Things have happened. I'm not going to go into other details. But if you add those numbers up, and then all of a sudden, here's the question that comes from the numbers. Dr. Chip, what happens to a person that doesn't find any kind of outlet or any kind of resource or
Mhm.
anything that's been through and seen? What if they don't? Mentally, there's going to be problems. Physically, there's going to be problems.
Mhm.
What happens if somebody doesn't begin help?
I think the analogy I would use is that, in your car, when you start to press on the gas and you start to rev up the engine, and the little needle goes back and forth, and then as you continue to press on the gas and it goes over and you get into that red area, that's basically what happens, is that their motor's going, their stress response in this case is driving their behaviors. And some of the things that happen is that the more you're there, and it makes sense. And so whether you're an athlete or whether you're a tactical athlete, you're in that environment. When something happens, you recognize it faster, you anticipate things happening, and it's a life-saving thing, the ability to see something, to anticipate something. But even that anticipation drives that stress response. And so you've got the needle in the red, and then if every day you still see stuff, and maybe nothing traumatic actually happens, but you see things that could be, and that anticipation keeps that stress response fired up, and it keeps that needle in the red. And so there's not a chance for recovery. And so if you looked at your, like at a daily work log, and you're like, well, something happened on Monday that was very traumatic, but nothing happened on Tuesday or Wednesday or Thursday. Well, that's not exactly right, because what happened on Monday is still with you, and it's still part of your memory, and you're still using that to survive and to do a job. And so just because nothing happened that you had to respond to doesn't mean that you're not already responding. And so it keeps that needle in the red, and you don't get a chance to recover. um, and then that then kind of magnifies, and you're just more ready for it, and you start to see things in that way. In the short term, it's a lifesaver. In the long term, it can have, uh, well, the trauma can have some real physiological effects, on cardiovascular health, for example, in ways that it might elevate blood pressure and contribute to heart disease, on metabolic disorders, and maybe contributing to, um, depending on how you respond to it. Sometimes people do different things to mask what's going on. Sometimes they eat, as an outlet. We tend to look for activities or distractions, and so sometimes somebody chooses eating. Sometimes somebody chooses exercise. Or choose different things, and well, a lot of those then are, and sometimes people just work more. And I think that, if I were making a prediction about you, just from what I know about us, uh, is that when you just work more, you just focus more, you just go harder, and
Mhm.
and then that actually is an outlet, because it you never have to actually deal with what had happened before. And so I think those are some of the things that happen, though, if you don't have a chance to recover. And so we have lots of good information in the sports sciences and the military sciences, and we know that physically you can do this much stuff, this kind of demanding work, and then when you do this much, then you need to rest this much. And so we have that worked out for physical tasks, but we don't have it worked out for psychological tasks. And just like people vary in size and strength for a physical task, they also vary in terms of their capacity for handling uh, uh, traumatic and traumatic situations. And so what's kind of interesting to me is that, if I were to make a prediction, we might agree that people who don't have the same capacity to deal with trauma are more likely to be traumatized, and that would be true if everything else was equal. But
Mhm.
it's actually people who have a greater capacity to deal with trauma that find themselves in traumatic situations more. And so they're actually more likely to experience trauma. It's like being an athlete. The safest place to be an athlete, not getting ACL injuries on the bench.
Hmm.
And and so I think that that's one of the challenges too, is that sometimes our strengths become or they put us at risk because we just keep on moving and keep on going forward and keep on dealing with things. And I think that's as you describe it, I think that's part of where you find yourself, is that the work itself has actually become an outlet, and it prevents you uh, well prevents it gives you something to do without having to deal with some of the things that have happened. And that's what you're doing now, and that's the whole painting for PTSD part of it. And that's a hard trade-off when you take. And so I think this is from a kind of a neurochemical point of view, is that some people, when they have that stress response, some people like the adrenaline rush. There's some people who have more risk-taking behaviors to start with, and they like the adrenaline rush, and can even become habituated to it. So, like, you get a little dose of adrenaline today, woo, and then tomorrow, like, yeah, I got to do something more, and then the next day, you got to do something more. And
Yeah.
so sometimes the adrenaline becomes a drug, and when you're doing certain things, and you're changing, so you get some adrenaline, you get some dopamine, you get some endorphins. You talk about pain. If you like pain, you probably get a pretty good kick of endorphins when at some point in time from it. And so now you've got these high energy, the adrenaline, and then you've got dopamine and endorphins. These are feel good neurochemicals, and they bind to pleasure receptors in the brain. And so in that way, the uh, the capacity to deal with that comes with also uh, that habituation to that level of stress or that level of demand. And so it's almost if I don't know, it's well, in the brain, because they're pleasure receptors. It's not unlike a drug addict who keeps need you need a little more, you need a little more, you need a little more. And there's actually some characteristics of addiction there,
Yeah. And
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 that keeps you in the red.
ironically, this is going to make people laugh. Um, be in high school, I was the band geek, and you were the football player who liked to fight everybody. And then I got out of high school and I went to the military and started training, and then I spent a lifetime, and I have more fights than Floyd Merriweather and all of his friends put together as a professional in uniform.
Yeah.
And I would have to say, and I did one of the podcasts early was talking about addictions, and I said, I yeah, I'm addicted to protein shakes. I'm addicted to working out, being competitive. I'm addicted to fighting. I'm addicted to violence. And that's something that I knew, but I also had very good control of it because I didn't want to go to prison for it. And becoming an instructor and teaching self-defense and use of force, and I went through a lot of instructor classes. Uh, Two of them, well, one's the FBI, one of them was put on by the U.S. Marshals. But I got certified. It's this fancy thing where I'm an expert witness in federal court for use of force. So I can go testify in federal court about use of force. And I've written and testified about officers doing certain things in police shooting. But it's funny that our roles kind of changed because I became the physically aggressive person as an adult, opposite of our childhood. And here I am. I'm stuck.
Mhm. Now you
And
say it that way. I think maybe you just had different outlets, because I remember you actually got a gun first, a BB gun first, and so then I had a BB gun, right? So there's some things.
yeah,
So I think you found an outlet outside, walking through the woods. I don't know, shoot squirrels with the
yeah.
BB gun, and then and so I remember because you would go fishing, and so you were a good outdoorsman. You went fishing, you went hunting and stuff. You got it right,
Yeah.
and I remember my idea of a good time for fishing was to go down, throw bread in the water, and then shoot them with the gun when
Yeah.
they came up, and
Yeah.
so you wouldn't go fishing with me anymore,
Yeah.
and but I think that in that way that you had another outlet that was physically active, that was well you're good at it. I'm not still not very good. I like shooting guns, but not a very good hunter. I couldn't sit in the tree stand all day for one opportunity to shoot a deer, or you know.
Well, officially I've been on those police stakeouts where you sit in a car
Mhm,
for 8, 10, 12, 14 hours,
mhm,
and somebody brings you food, whatever, or you pack food and you got to run over into the store in the bathroom with your partner's in the car kind of deal. I've done those, TV show stakeouts. Boring and very educational. You learn a whole lot
mhm.
about the law and all the things you never studied in policy and procedure from your partner,
Yeah.
and you just talk. There's only so much you can talk about in that much time. So,
Mhm,
but um, you've shed a lot of light for people, and I'm watching. I've got 3 devices. I'm watching some different things in analytics with this right now, and again, this becomes a challenging for us. And to change the topic here as we get ready to close, this kind of more for me and you, but for everybody else too, to help. I'm in large communities. If I made a video and I talked about correction officer or police officer in a bad situation with some video, and I talked in commentary, I have thousands of people there or thousands of people on. I've done live videos talking about immigration protests and things,
mhm,
and in 10 minutes I got 10,000 people that are on. Can I see the numbers and I know
mhm,
this is one of those most difficult things that people don't want to admit, and so here's the question, and I texted you something a couple hours ago about it, so we can just talk about this now here for everybody to hear as a direction. To have a podcast that draws people into this topic. Where do we go to advertise? I advertise in Facebook groups, the law enforcement ones that I'm in, veteran groups, my page in Linked. I'm in a group, a mental health group on Linked that has 832,000 people as of 5 days ago when I made a post and talked about this podcast. But yet I don't see any of those 832,000 people on here because I got a little head and tells me how many people right now are watching actively, and it's 3. So how do we take a serious conversation that saves lives, that saves families, that saves marriages, something that's this critical, and it's totally, I'm not saying I'm the experiment in all of this. I just
mhm,
initiated something, and then I knew, when it was the right time, and then we joined together and talk about something. So, for me, the things to go next, and I got the apparel store going. I advertise it, through different places for people to see, but yet people aren't wanting to buy a shirt that says painting for PTSD podcast.
mhm,
I don't know. I'm not going to give up on it. So I guess kind of,
mhm,
a thought process for us, some flyers. I got a few more doctor's appointments I need to get to. There are some treatment facilities that are here in the area that I could go. 2 of them that are kind of connected to the county jail, that I ran for jailer, so they already know me
mhm,
because I talked to one of the directors 3 years ago when I ran for office. But it might be something to do where I go talk to them and see if I can get, there's funding there. They can get books. These things I got it. These canvases that come with paint, I got them at Michael's on clearance, $5 a piece. So I'm sure the director and funding can
mhm,
go, and they got 25 people in a treatment program. He can go buy 25 of those at $5 a piece. I'm sure there's funding for that because I,
mhm,
I know what they do and that they fund for the jail. But as a place to take this to help it to grow, and it can't grow instantly,
mhm,
but to get the beast and the professor for PTSD to get out there. Some flyers, some business cards are some thoughts of mine in the future.
Mhm.
The apparel guy's going to make some polo shirts for us. I just haven't got over to him. I've talked to him about it, but it's just been, a lot of appointments and feeling bad and just not
Mhm.
getting out. But some things kind of locally, I've entertained the idea of interviewing the guy I ran against, because we're still friends. He's retired police chief, the jailer. One of his deputies, I told you, committed suicide this year, and he would be a good guest. It would be something good to have on, and maybe with him we would do a Zoom, like where you
Mhm.
can control it on your end, and then we'll just put it on and be live later.
Mhm.
But that way, the three of us can talk. I think he would
Yeah.
really like, to do it at a time, and to meet you also. But that's a way, and just kind of maybe go to some VA. I just need my health to get a little bit better to get out and be set up at somebody's place outside home. So that's kind of some thinking in the future,
Mhm.
and do that normal flyer kind of stuff. Um, I don't know, on your end,
Yeah.
you're in a complete different community through education and social media than I am,
Mhm.
and access to different people, different classes, different courses. As we continue and go on this, maybe there's places that you can tell people, hey, my brother and he's got this podcast and we talk about PTSD. Be great for you guys, great for this. I'd like to go into a high school and maybe give a speech to seniors. I don't know if the high schools want me to come in and talk to them. I don't know if they want to hear what I got to say. They don't tend to not like
Yeah.
reality. But
Mhm.
you see what I'm getting at. Maybe,
Right.
there's some people I've
You
tried
know.
to reach out to the head of the criminal justice program at NKU, Northern Kentucky
Mhm.
University. And I didn't try
Yeah.
Cincinnati or anything, because they have all Cincinnati police and stuff there. But I've tried a couple times for 3 years in a row, even during my campaign,
Mhm.
and they wouldn't let me come. And like, I have experience in military, in police, in corrections, and in private security
Mhm.
companies. All four of those. And formal training of stuff, and they didn't even want me to come in and talk. But
Mhm.
this might, something, and we can always go through the Zoom your way, and have different people, have 5 or 10 people, or you can invite some people and me, and then just 6 or 8 people just sit around a round table and talk about it. So it may
Mhm.
take some things like that. If we did that with, say, 6 people plus us, then
Mhm.
that's 6 people involved, and maybe those 6 people can go tell one person.
Mhm.
We may have to do that thing where 2 people tell somebody, and 2 and 2 is 4, and 4 and 4 is 8,
Yeah.
and it may take some time. And then also, I'm going to look a little bit. I'm going to find that company, and what it would take to link, where we could link like YouTube and Spotify and Apple, so we'd be live on and stream on multiple platforms at the same time.
Mhm.
Who's that middleman? What are they charging? What are they doing? That may be the next steps, because I don't want to stay, with numbers of 5 and 10 and 20, and
Mhm.
a month later, there's only 50 or 80 people that have seen that one podcast. The
Mhm.
numbers need to be in the thousands. So the
Yeah.
goal is to not give up and quit, because this was important enough. And, I prayed about it. It was important enough to do it. And it's important enough to get to the point, that we can do this together, because together we can bring a lot to people.
Mhm.
They need to see two sides. They need to hear it.
Mhm.
So, I think, making this list in my head, and I'll write it down later, all these things that I can explore and that you can explore, and we'll just have to build it. And then, where we're getting into October and fall and holiday season, we have to be here, because, holiday season brings a lot of suicidal thoughts and tendencies, and then acting out. And
Mhm.
I've had friends that have committed suicide in the holiday season. So it's kind
Mhm.
of personal to me for this. But we'll stay here with the people, and maybe 2026 would be the year that we kind of multi-platform beyond YouTube. because that's what everybody else does to get the message out.
Yeah.
It may take
Yeah.
this.
I think one thing, if I were looking at it in that context, one of the things that I would look at is that, for example, all the things that we talked about, the overworking or the substance use, or s- the avoidance of certain situations, the risk taking behavior. Sometimes people become like very perfectionistic and they try to control everything just to get their world in order. Well, all of these
Mhm.
things that are characteristics of behavioral responses for somebody with trauma, these are also the same behavioral responses for somebody who's just trying to get through the day and they're still trying to develop skill sets. And so it's the same kind of psychological response, but it's on two different levels. And I think one of the challenges is that you're right in the middle of the shit. And so when you're talking about it, it's deep and it's intense. And that's, I guess, the analogy that I would use is that's going right into the medical school, and you haven't finished second grade yet. But you still have to learn to read and write. You still have to learn to think about stuff. And so the things that you would need in medical school are still the same basic things you need in second grade. I'm saying maybe the the podcast is here and the programming is here. And part of the reason I think about that, I was talking to some students the other day, and they were telling me, he's like, "You ever see this podcast?" I'm like, "No, I don't watch podcasts. Like, I got stuff to do." And and so this is a student who, I'm solid D student, and they're like, "Oh yeah." So I'm thinking, because I have them in class, and I'm like, "Well," so I thought it must have been a 10-minute podcast if they watched the whole thing all the way through. And they're like, "No, this was 90 minutes." And so it was interesting because I started talking about, well, why they watched the podcast for 90 minutes and they can't pay attention in class for 10. And so
Mhm.
something wasn't reconciling there. So I was asking them, they were schooling me on this and coaching me up. And basically, with what they enjoyed about the podcast is that they enjoyed it, is that it was a low cognitive threshold. They didn't have to think hard. They didn't have to face any personal emotions. It didn't move them or make them uncomfortable in any way. I mean, you described it's like in pain. I'm telling you, you walk right in the middle of this stuff. Most people don't want to talk about it, and most people don't enjoy pain. And so, well, that's more like my class. In 10 minutes, well, that's what you get when you get 10 minutes, but it's dense content. It's got new stuff. It's got confusing stuff. It makes you have to think harder. It makes, sometimes it challenges things that you think you already learned, and then you learn you didn't actually know what you're talking about. And so being in a kind of a formal educational environment is a lot more demanding than a podcast. And the things that you're doing, and the things that I sent you, I mean, these are like from a graduate class, and literally, that's what I had. So that's a pretty high level for people to tune into. I think that the same concepts could be, if the focus was stress management. Well, now you have a level of expertise and knowledge and insights that are so far beyond what people need day to day, but it's still the same insights and wisdom that people need day to day. And so I guess that would be one thought that I would have, is that, you know what,
I,
you and I, maybe you're the beast and I'm the professor. Maybe we're not working. Maybe we'll do this at our level. Maybe we do it at the level of somebody who would be interested, entertained, and watch it for 90 minutes, like the student I was talking to.
I'm saying shout out to I'm gonna keep it real. They just message to say hello. Thanks for joining. Well, I don't know. Think how we can do that. But tell this. I'm gonna send this later tonight. I'll send the view link, the regular viewing link to
Mhm.
today's podcast, and tell them, say you like podcast, give that to them, post it to them, however you do or whatever, on slides, or give them that and say you like
Mhm.
podcasts. Watch this podcast I just did with my brother about PTSD, and tell me what you
Mhm.
think, and ask them, put it to
Yeah.
them, say, here's the thing, here's the extra bonus, extra credit, extracurricular. Watch this podcast and give an opinion about the content, about what he said, what we're doing, how to improve the podcast. Tell us
Mm,
something. See if you get any
yeah.
response. I don't know. And
So
maybe we are too
yeah.
like Gil
Well, here's
Grissom on
why.
CSI. We're too
Yeah,
scientific.
yeah. Right. And so here's why I couldn't do that. Because it would be because this is the level of focus and intensity of the subject. If I were to take this into a group of 50 students, I know generally my students. I know, but I don't know who's been through what kind of traumatic situations.
Hmm.
I don't know who's had a family member that's killed themselves. I don't know. I don't know all of those things. And so if I bring something into class uh, and I'm not prepared and they're not prepared for how they're going to respond to it, even if they don't know, then I can't responsibly bring in there and talk. And
Yeah,
so even in my graduate class, we don't talk. We identify PTSD as the end of this is what if this happens, then this can happen, and then here's some ways things to and then right what are some of the lifestyle behavior that you can do to begin to work with somebody or to recognize that or help them out. But it's very superficial because um, it's yeah it's to protect them, and it's actually from an instructor point of view, there's a liability to it,
I
and
get
so
you.
I
I get
can't
you.
I can't I can't ask them. I can't put them in a position that they don't know how they're going to respond, and I don't want to deal with it. But that is because this is you're starting at a pretty high level of this, and from being right in the middle of it with a bird's eye view, and so here's some things that I would take from it for like a college student level who's just they're just moved out of the house. They're barely. It's the resilience. So there's certain things that are just the same, but they're on different levels. One is the resilience. One is the personal responsibility. One is the self care. So those are things. Everything that you're talking about um, is like a master class in how to deal with stress for people day to day. And if we can scale that master class down to a public level where it's not so demanding, and they're like, oh yeah, that sounds like fun, I could do that, or oh that's great, I could do that, then stress management is a big topic because everybody's stressed.
I follow a guy that's a couple guys that were Navy SEALs, and they have podcasts, and they don't talk about stress. They talk about other things and identifying the fake and the
Mhm.
posers. I'm going to reach out to one of them and see if I can get some answers from him about what you just said about me, and
Mhm.
see if it's something I can get a phone call or get a messenger call with him or something like that, and then see if he'd be interested in kind of a off the record
Mhm.
conversation with the three of us, maybe a Zoom call one day, and just kind of you can tell him what you just said about me, and then kind of see what people, because what he's been through in the war as a 20-year special force, Navy SEAL. I forget his whole background because they get involved in different things and projects and Delta operators. You know, do they ever, when they get out, get involved with their self healing, or is their
Mhm.
podcast about people they're self healing? I'm going to reach out
Yeah.
to them and kind of see,
Yeah.
because it's
You
I
know.
I could try and tone down, and that's like I can't walk in a treatment center and start talking about, hey, I watched the guy shoot somebody over my head and stuff like that, and people hanging kind of conversation.
Mhm.
But I can talk about things in substance abuse and just keep it specific.
Mhm.
Kind of lower the level of conversation.
Yeah.
So maybe the content needs to have a ladder of levels.
Right.
In each
Right. Yeah.
ladder, some
Mhm.
of it going up is more serious, but also you know, like organizational chart, some of it goes out and some of it goes down,
Mhm.
or one of those pies where you just go in different directions and you don't
Mhm.
qualify severity or not. Don't
Right.
minimize somebody's stress.
Mhm.
But that might mean direction. I don't know. I don't know. We
Yeah.
we find and connect with the right person in the right direction to, not saying we need to be sponsored by somebody else,
Right.
but to find the right people. That guy I told you about, the football player, reach out with him. Maybe if we
Mhm.
had a Zoom, would get him to get on and talk about stuff in the
Yeah.
NFL, what he went through. And
Yeah.
by the way, I'll throw this out really quick to those watching at this point, before I close. Many, many years ago, the Kansas City Chiefs did offer Dr. Chip Larson to be a strength coach. Just want to throw that out there and let people,
Mm.
give you some praise
Mhm.
as one of the stepping stones of your career.
Yeah.
That's it. Are you supposed to step back and do that? We didn't see any
Yeah.
muscle right there. I just saw your shirt move.
Yeah.
But yeah, that just gives some
Yeah.
ideas. So I'm going to
Mhm.
think, and we'll message a little bit more here before we get to the next, to see what
Yeah.
direction the next conversation is, and maybe we get a side place
Yeah.
with somebody. And I don't know. I'm kind of right now thinking to get ready. We're less than 100 days for Christmas. I got to remind
Mhm.
everybody, September
Yeah.
25th. But as this year ends, in a business world, you're always thinking, hey, fourth quarter, you think plan for
Mhm.
first quarter.
Yeah.
So what does 2026 look like for us with this? And that's I'm glad you said about that liability in your class and not talking,
Mhm.
because I was kind of thinking you could tell them, hey, I'm on this podcast. You guys can see me and we talk about this. It's a podcast. It's not school related. It's not
Mhm.
your job related. We're not getting
Yeah.
paid to do this. So I didn't think there would be a liability to mention that, but I wasn't
Yeah.
thinking somebody in class, might have a stressor.
Right.
At the 55-minute mark on this one, I said something to you, and I was talking about my friend in Turkey doing Russian roulette, and then watching that,
Mhm.
and then you started speaking. I was checking my pulse. My pulse got up to about 90 beats a minute, and I was starting to I was going to sweat. I had a real anxiety attack come right after I
Mhm.
talked about that, and I just kind of just froze like and let you talk, and I'm checking my pulse down here. My body just changed just that quick, get that physical
Mhm.
thing. But and I also know that I haven't had dinner yet. I need to eat dinner.
Yeah.
So, we'll wrap this up and think about, long term. I'm going to research some streaming. I want to get really into exactly what to Spotify and Apple Podcasts,
Mhm.
what the details are. We looked into Rumble and kind of explored that option, and that Rumble option didn't get anywhere. Didn't
Mhm.
show any results. It still hasn't. Other videos I post, and it's just not. No, nobody's connecting to me. I don't know if I don't have the right hashtags or I'm doing something wrong. But even with subscription Rumble, where they promise to draw more attention to your channel, nobody paid attention to me at all for
Mhm.
2 months.
Yeah.
Zero.
Yeah.
So we'll explore, and I'll share those things with you, and
Yeah.
we'll figure out.
You know, this I guess this is the I think we've talked about it in this concept before is that one of my new projects for next year is second wind. It's kind of the second wind aspect of it. It's the other end of this conversation, and the concept of second wind is that it originates like with a aerobic exercise and running, and you get to a certain point, and you know you actually have some well glycogen depletion. You kind of hit a wall, but then you slow down. Then you get your second wind, but that concept applies, and this could be modified in a way to match this discussion. But it, for a second wind, that could be somebody who, it could be a high school athlete who had a knee injury. It could be somebody who fell. It could be a grandparent who fell and then they broke a hip and then they're recovering and now they're getting their second wind. Or Susan and I are now empty nesters, and so
Yeah,
there's things in our relationship, and then socially that we haven't been able to do for 30 years. And so now we could take a trip on a weekend if we wanted to. And so it's like a second wind in some ways. And in
yeah,
some ways, then from a training point of view, it's a second wind because now I don't have to take kids to practice and pick them up. And so the concept there is it's a more um, it's a kind of gentler approach from recognizing whatever your situation is, small or big, recognizing that there's certain fundamental things that make people successful at it, whether it's a small or a big thing. And then acknowledging that, man, with a perspective that here's some of the things that some people are dealing with. And here's some things that, and it's it's a it's an it's a I guess it targets a larger audience. But all the things that you're describing, there's things that you've been doing the last 30 years that are on in this category in terms of the training and the strongman stuff, and you know, and the way that you continue to get educated about things. All of that is that's just on the other side. And that's the stuff that so most people are most people, if they haven't already done what you've done, they're not going to. And most people will never even begin to comprehend it, even after hearing it. People like stories, but they won't really understand it. What they will
Yeah.
understand is how did you manage yourself? How did you lead yourself? How did you get ready for work every day? How did you handle the challenges of life and work and a family and kids? And the fact that you have a strong marriage and great kids. Nah, that's not normal. That's not normal for somebody who's been in law enforcement and corrections is 58 years old.
Yeah.
You've had a fairly normal life, you know, in terms of your relationships and your family relationships. That's not typical. And so there's things that you did along the way that many people can relate to, even if they can't relate to pulling somebody down if they've been hanging in a jail cell. They're
Hmm.
like, well, that's a story. That's crazy. Craziest thing I've heard all day, all month, maybe in my life. And but they can relate to this is how this is how you managed it. This is how you sustained a marriage, which should be something that every law enforcement, new law enforcement officer is aware of. Is it's a challenge. Anybody in the military, they should be aware it's a challenge. I think everybody knows it's a challenge,
Hmm.
uh, and yet you've done that, and so I think that there's a lot. There's a lot in that way, that informs how you're working through this now. But there's a lot of things that are scaffolded down, like at a second grade level. Let's get through middle
Yeah.
school and high school and college, and that's good stuff too. Now, see,
Yeah.
this is for you and I, especially for you because we talked about being in the red. It's not going to be very exciting, maybe compared to. So I'm just giving you a heads up. What might be more interesting to more people is going to be less exciting for you and me
Yeah. I
because
get
it's
it.
more routine. It's more routine. We
Yeah.
we were not born for routine, and it's so
Yeah.
that's
We'll figure it
that's
out.
that's part of our shared reality is that we weren't born for routine, and but that's where your TikTok audience is, or your social media audience. It's a day-to-day stuff that everybody can relate to.
Yeah. All right. Yeah. We'll figure that out.
Some yeah, yeah, we will.
I'm
We will figure it out because that's
I'm
what we
getting
do.
really
We figure
lightheaded,
stuff out. All right.
I gotta because of this medicine. It's time for me to
Yeah.
eat.
All right.
Time for me to
I see.
eat.
Great,
But
great talking with you.
yeah, it was, and hopefully we'll get some people that and I had two people message me while we were doing this, friends that they were at work and couldn't get on or their phone, and they're going to watch it later. The two of them that have been on guests with me before. So, a lot of the people, law enforcement, they're working shift right now, or they're sleeping, or they're just getting ready to go in at 9 or 10 o'clock. And they catch it later. So,
Mhm.
I'll do advertising again. Post video, post right now, and that's when some people get on. They're missing out by being live and putting their comments in, but they'll catch it later. I know
Mhm.
Connor's busy with his baby right now, and he'll watch it in a day or so.
Mhm.
He'll listen to it on his way to work. That's what he usually does when I talk to him.
Yeah.
So, but we'll figure some things and
Mhm.
plan future, not just a month ahead or 3 months,
Mhm.
but
Yeah.
to build up a loud platform. It takes time,
Mhm.
and some platforms have steps. 10 steps or 3 steps. I don't know. It just
Mhm.
depends on, we find that right, inch our way with this niche into that right crowd somehow,
Mhm.
and we'll get there. America right now is struggling, with recent events that I
Mhm.
don't talk about because of obvious reasons. Half of America is struggling, the other half is mad.
Mhm.
So there's a need, there's just not a willingness to go get it.
Mhm.
So we'll figure out
Yeah.
where.
And how would that be for a conversation? So you better go get something to eat because you're getting lightheaded. But so
Yeah,
you know, the Beast and the Professor. What? How interesting would that be to actually have a two-dimensional conversation?
yeah,
That would be That would be routine, but it would be fairly unusual. Uh, you know,
yeah,
to say an idea and then to listen to an idea and then to still
yeah,
be brothers and still be friends and
yeah,
to recognize neither of us knows everything about everything.
yeah,
Well, how about that? Who knew that the things we did every day growing up would actually be unusual in
yeah,
2025? Who knew
yeah.
that?
No,
Man, how
we didn't
boring a
know.
job would that be to do what we do anyway?
Yeah, we didn't know.
Yeah. All right. See, we go take care of yourself.
Yeah, you too. You too. We'll talk soon.
All
Good
right.
night, everybody.
Good night.